Let's discuss my number one concern when it comes to the difference between original Medicare and Medicare Advantage. It's the concept of prior authorization. Under original Medicare, you do not need prior authorization for services. Under Medicare Advantage, you do. So I'm going to explain what this means with an example. I've used this example before, but here we go. So in the summer of 2023, my dad got injured. He had to spend 5 nights in a hospital. Towards the end of the stay, his doctor said, "Glenn, you need to go to a skilled nursing facility care. You need to get some rehab." Now, my dad is enrolled in original Medicare. He has a Medicare supplement policy. So what happens next is he goes. He does not need prior authorization. In the alternative, if my dad had been in a Medicare Advantage plan and after the 5-day stay, his doctor said, "Glenn, you need to go to a skilled nursing facility care to get rehab," before he could go, the managed care company has to agree with the doctor's assessment. So why is this my number one concern, the difference between original Medicare and Medicare Advantage? It's because there have been some reports where there have been services denied under Medicare Advantage plans that had you been in an original Medicare, you would have got the coverage. Does not mean it's going to happen to you. You just have to know about the concept of prior authorization and make sure you're comfortable with it. If you are in an HMO or a PPO pre-65, you're already dealing with that concept. There just happens to be this freedom with original Medicare where you don't need it. Of course, the doctors do have to code why the services were medically necessary, but that is different than the prior authorization that is required under Medicare Advantage plan.